Janet Valdez, Liability Issues and Disaster. The costly aftermath of the September 11th attack and Hurricane Katrina are two great examples that illustrate the need for well-considered disaster response strategies in terms of liability. Throughout the emergency response efforts, the unique goal is safety and saving lives. However, liability issues are at times ignored when faced with such catastrophic events. Liability comes hand in hand with proper implementation. Implementation is the process of putting laws and regulations into operations. For example, translating them from paper into operating programs and processes. The implementation of policies is typically done by public agencies, but increasingly often is also being done by third parties through the privatizations and contracting of out-of-government services. The implementation of policies is overseen by the chief executive and administrative officials and by the legislative body to ensure that the policies that are being operated effectively and as intended. In some cases, higher administrators and even legislative committees and individual legislators may attempt to micromanage these policies and implement them. Micromanaging implementations of policy is vital. It is vital because it ensures that the intent is being followed, may aid in identifying fraud and abuse, collects information of the policy and on the policy, assesses its effectiveness, and forces changes in unpopular regulations and other actions regarding that specific policy. If not micromanaged properly, disaster liabilities may arise. For example, actions taken or not taken place during the disaster, response actions perceived as negatively affecting income, customers whose supply may be affected during or after the disaster, and negligence from an organization, disaster volunteer, and/or government employee during that emergency or disaster. Hurricane Katrina. After the poor federal response to Hurricane Katrina in 2005, it became clear that the relationship between FEMA and other federal agencies and their state and local counterparts were adversarial, and there was little intergovernmental coordination and cooperation. The National Response Plan had recently been activated, and many participants, including state and federal officials, did not understand the plan. This is also the case with National Incident Management System, or NIMS. It had only been in effect for a couple of months, and many of the participants did not know how to operate under this system. Critical errors were made in the evacuation of New Orleans and other communities. No government level assumed the role immediately, producing a confusion pattern. Liability issues and Hurricane Katrina. Over 200 deaths occurred from nursing homes and hospitals due to floods and the shutting down of their operational systems and electricity. Many of the healthcare professionals, or VHPs, that aided also had liability issues, such as ensuring, licensing and credentials, emergency declarations, civil liabilities, and the reparation of VHP. Avoiding liability issues. Emergency managers must plan effectively, ensuring the proper implementation of policy and procedure to efficiently execute response and recovery efforts. They must include safeguards after the aftershocks. They must test, measure, and validate effectiveness of the plans, and must provide clear, concise, and accurate communications between all organizations.